and always want to see a Jack in the Box, and I'm always thinking of, Nicole I am. But it's actually pretty good stuff. Usually, I don't think I've ever gotten a burger there, but it's little chicken nuggets or something.
So it's deep fried, you know it's gonna be good.
Yeah, I know. Make sure it's scorched.
Burn it.
Well, sometimes people put those burgers under the heat lamps after they've made them and they stay there.
Mhm.
Kentucky Fried Chicken. Oh gosh, that just scares the crap out of me. I mean, it just stays. They make a big batch and it just stays underneath there. And you can tell that if it's been a little while and they haven't sold anything, you get the harder kind of stuff. And it's just not as hot as what you'd think it would be. I don't really
I was just reading something online. Has anybody heard that Kentucky Fried Chicken isn't chicken? They can't call it chicken anymore. That's why they went to KFC.
That's what I heard. I saw that somewhere, whether it was on Facebook or something, how they grew those genetically.
That's what I read.
Yeah. But you know what? I was watching a KFC commercial right after I saw that, and they said chicken. So they said that they couldn't put chicken into any of their ads, so they should be able to put it on TV if it was chicken. So I don't know. I think that was a little bit of
That's kind of like years ago, the Wendy's. Do you remember the Wendy's scare with the worm burgers?
Does
anybody remember that?
Worm
No.
burgers.
Yeah, there was. I mean, it got out on the news. It was just all over the place that Wendy's was using worms to fill as a filler for their hamburgers,
Seems
which
like
is
I
common sense
remember
tells
something.
you worms are expensive.
Yeah.
They're not cheap as compared to
I'd say a
hamburgers.
lot of that stuff they use a lot of bulk like grains and soy and things. But now soy is starting to go up a little bit too, so I don't know how much they're using that anymore. But you can tell by the texture, it almost reminds me a little bit of places like a veggie burger in a way, how it's all connected, weird. And I'm like, that looks like my veggie burger.
You ever seen the beef that Arby's uses before they cook it?
Mhm.
I used years ago when they
Oh,
switched
God.
from top round
I
to
crave that every
processed
once in a
beef.
while.
They take the prime cuts of the cow and they like cube them. So that part of it's okay. But then they take the trimmings and the fat and so forth, and that's what they use to pack it together. When you open it up, it looks just like dog food.
Wow. Well, that's pretty much what dog food. I mean,
It's
you
sticky.
get a lot of the. That's awful because a lot of the food that you feed your animals, it's a lot of that excess fat and stuff that you typically wouldn't
Mhm.
put in the meat for us. They get it.
They had to go that route. I ran those places for years. They had to go that route because of the cost of trying to get I forget what cut of meat it was called. That if you remember the old mechanical slicers, you don't really see them anymore.
Yeah.
But it was out of necessity.
Wow.
Price wise, it would have went crazy.
Well, it's still pressed in. It looks like it's sliced like that.
Yeah. Oh yeah. When it cooks, it cooks down. It almost reminds you of a lunch meat spam.
Yeah. That sounds more like.
But if they-
spam.
If they cut it real thick, you'll get if they don't have a sharp blade, the thickness of the cut, it'll be rubbery. The meat, the texture will be rubbery. So the thinner they slice it, the more the texture is that of regular.
Thinking about it, it is a little bit like that.
Yeah. Yep.
When you bite into it, it is almost like you're kind of biting into what you would think a rubber ball would be
It's a
like.
little
if you
spongy.
were to- Yeah, I
Absolutely.
kind of got that.
Well, now, how about for turkey?
Oh man, I'm not. Yeah,
Well-
I know. I've gotten their turkey cheddar.
If it's
belt
something
now.
gross, I don't want to know, but
When I was there, the turkey was turkey breasts, and they process. You can go to the store and buy a turkey roll, and it's just kind of held together by that wrapping or string or whatever.
right.
But it's been formed, and that's what that's what that was.
okay,
Still
'cause it's
processed.
good.
It's
Yeah.
still
And their corned beef is the real deal.
the real thing.
Yeah, it's not processed. Yeah.
Like
Wow.
the bacon ranch.
Well, you take all that Arby's sauce, you take all the cheddar off. I can imagine.
Yeah.
Biting into it and being a little.
Yeah, roll it up.
rubbery.
Yeah, I
Yeah.
want to eat it.
Roll it
I
up
know
once and just eat the piece of meat once by itself. I'm not saying it's not good. I like
Right,
the taste
right.
of it, but it's a different texture.
Now,
because
is that Angus stuff, is that a little different? Because usually it tastes a little different.
when I got out of it, we weren't using the Angus.
Using the
It's
Angus.
been years since I.
The Angus seems like it tears a little bit more like meat
Mhm.
would.
Mhm.
Yeah. Okay.
I
Well,
heard
I know
once
what I'm
they
doing
use
and not
kangaroo
doing there.
Their roast
We
beef,
learned
and
so
I'm like,
many things in
I'm
here,
not-
maybe it's not.
I ain't eat their roast beef in probably 15 years or more. It's probably been longer than that. Now the turkey I'll eat, but once I heard they use,
Like I said, the corned beef's the real deal.
Oh, kangaroo?
yeah, I heard it was
I bet you
many
kangaroos get
years
the-
ago. My uncle
It's supposed to be a
drove
leader
their truck, and he told me it was actually kangaroo meat that they used.
But
And
most of
I quit eating their roast beef.
Not
after
that kangaroos aren't cute, because they are, but I think it is leaner meat. I think that'd be more expensive than
I was gonna
anything
say,
else.
most of the time, if you do when you get these scares out, that they're doing this, and if you just do the math on it, the cheapest meat there is out there is a cow, basically,
Right,
or a
right.
chicken. I mean, it doesn't get any cheaper than that to raise.
Right,
dog.
yeah.
No, that's expensive.
Kitty kitty.
Seriously, cats, dogs, if they, you hear all those are expensive.
Free the neighbor.
The old joke about going to a Chinese restaurant and never find a cat around to buy. Oh, we
that's
digress.
funny. Oh, goodness. All right, cholera epidemics, quite a few cholera epidemics. This is back in the 1800s. This one was towards the later end. But this particular epidemic here, this was where Broad Street joined Cambridge Street. Quite a few people died, over 500, in an area that was 250 yards by 250. They traced it back to the Broad Street water pump, and they stopped the epidemic by removing the pump handle. Now the water pump's still there, and it's a monument to John Snow, who is the father of epidemiology. So when you take a look at this map, you see where the Broad Street water pump is. And the little dots are the deaths. You can see the majority of the clusters of it's around the actual pump. But now you see some of these, and right in epidemiology we always call those outliers, but some people that you would wonder how it got there. If you read John Snow's journals, and they're out there, you'd find out that there was actually two different water sources that were supplying these different pumps. One was contaminated, one was not. This one still had the contaminated water. So now some of these people that live on the outside, they either went and visited their family or friends and they brought water. There were some people, and I guess just stubborn, they wanted to get their water from that particular pump because that's where they always got the water. So maybe there was something convenient there, like a store or something of that nature. But this was really the first of this whole epidemiology study, as far as one really being an official study. Now this is obviously a little primitive to what we can do now, but obviously John Snow went to people's houses, interviewed them, asked them where they got the water, and so forth. Nowadays, a lot of that information, and keep in mind, this is not just infectious diseases. There's people that study chronic diseases, part of epidemiology, genetic diseases, part of epidemiology, mental illnesses. A lot of people study risk factors and behaviors. So there's all different kinds of ways you can conduct an epidemiology study, but a lot of things, even surveys now are done over the phone or on the computer, so a lot of things is really electronic at this point. But at that time, I mean, there was nothing else to do besides go on foot. A lot of information, of course, is taken from various records, healthcare settings that can report only but so much. Notifiable diseases, everybody familiar with notifiable diseases. You can even go onto the CDC's website. They do compile all of that information. It's a little bit behind, but you can find out, for instance, how many gonorrhea cases there were in Montgomery County and so forth. They even have, if you want to find risk factors because of all the healthy people, 2010, 20, and so forth, all of those different objectives, you can actually go on to the CDC website and see how many people exercise so often or how many people smoke in this area. So it is a lot of very interesting information. A lot of those are that particular risk factors done by telephone surveys. But as far as going from house to house, might happen some. In the house episodes, everybody watch House at least once or twice. How they all went out to investigate, went to somebody, they sneaked out, broke in. I mean, not a lot goes on as far as on foot, but it will happen from time to time. Most everything's obtained from phone call, computer surveys, and so forth. So as far as a good definition of epidemiology, it's the study of occurrence of disease. And remember, so it's not just infectious. This could be mental, chronic, and so forth. We just always talk about the infectious here. Some of the things that you look at when this happened. So if there was a certain time period, where, maybe a common location. So if all of us were to go over to eat a honey baked ham and we all got sick, well, we'd have a certain time frame. We'd know where we all were at that was a common source. How it was transmitted. In that scenario, it would be from what we ate. Could be water sources, if you guys remember with the couple of West Nile cases last year, a vector was the source, so mosquitoes might be the source. So there's a lot of need sometimes to collect a lot of information, to collect food samples, water samples, vectors, and so forth. Now these are the things that you guys will want to know for the test, these definitions possibly on there. I want you to distinguish between the term epidemic, pandemic, endemic, and sporadic. An epidemic would be a disease outbreak like cholera. So you would have a lot of people that would be infected. So you would see a cluster. A pandemic would be a worldwide epidemic like AIDS. Now here, it's not quite as bad as in other countries. In other countries, you really notice that it is a pandemic elsewhere. But you see clusters all over the place. So that would be a pandemic. An endemic is something that's always present, like gonorrhea. Now, how would I determine whether gonorrhea was an endemic or fluctuated to be classified as an epidemic?
The number of people that was affected.
Right, so you would take a look at past years, see how many numbers, also in respect to the population. So you got to figure out, okay, did that population increase by so many thousands? That's why we got another case or two. So you want to look at the past years, and yes, obviously, if you see those numbers drastically increase, could be signs that there's an epidemic. Now we always have influenza epidemics. So things that would be sporadic, they would occur very occasionally, like something tetanus, for instance. You might see cases, you might not, but here and there you might have a couple. So this is a good picture here, all these dots. So this would be something that's endemic. So I have steady numbers time and time again, but it's not a lot of clustering, and it's not outrageous. Now, things like that might be useful, especially when people, you always hear of radioactive material and water and so forth, and you've got a cluster of cancer. So that's something you might have normal cancer numbers in that area, but when it all of a sudden goes up, hey, there's something going on. The epidemic, you can see the clusters right here. Pandemic, you can see that there's quite a few all over the place. This again, not going to be on the test. Sources of information, we kind of talked about this. Public record, questionnaires, surveys, hospital records. You can still go on foot and interview people, although a lot of information is taken from studies and surveys. A lot of epidemiologists use a survey that somebody's done and rework those numbers, and then somebody else will try to find another correlation within that survey that somebody hasn't even looked at. Especially a lot of nurses and physicians participate in surveys. Some of those surveys will be different studies that can go for 20 years, and it's all about behavior. Smoking was one of the ones that they actually used a bunch of physicians, and they followed them for years to find the effects of cigarette smoking. So It's interesting. Notifiable diseases. Now keep in mind, I think your book's got the list of notifiable diseases, a lot of things on there, STDs. Things that are easily transmitted, like tuberculosis, for instance. You can actually look onto the CDC and see how many cases you had in an area. But like I said, they're a little bit behind. Not quite up to date. It's stuck on there a few months, maybe a year afterwards. As far as incidence rate, prevalence rate, I'm not going to ask you these, but the incidence rate measures the number of new cases over a certain period of time compared with the healthy population. Also, I think an easier definition is rate of acquiring a disease at a certain period. Now, each of these has a numerator and a denominator. So when you're comparing to the healthy population, that could be how many of us have a cold out of everybody at Fortis. So that school population would be the bottom, for instance. The prevalence rate's the total number of existing cases with respect to the population. It's the rate of having a certain disease at a specific time. I want to kind of simplify this for you because they sound a lot the same. And actually, the incidence rate and the prevalence rate can be very close if the incubation time is very short and the illness is very long. So you can see those numbers would keep adding up and be close to the same. But now, really, the incidence rate, you kind of look at the odds of getting the disease, where the prevalence rate is who has it now. That's the easiest way to describe it. This is not on the test still. Descriptive epidemiology. You want to look at different information about the disease, like the incidence rate, prevalence rate, death rates. A lot of surveillance systems that track epidemics, like the influenza tracker. You see that on a variety of websites. Just to get you kind of thinking here, some of the things that you'll look at. This is the geographical distribution of tuberculosis, and obviously the darker areas are where there are more cases. Now, another chart is the ethnic distribution of tuberculosis. What might be something else that they'd look at? Age, all right, the age range, and there are age ranges that they'll put you in.
Jobs.
Okay, education, income, health insurance versus no health insurance is a biggie too. A lot of people are looking at that now. Male, female. We can skip through this, we can skip through this, we can skip through. I only want to stop here because I'm getting ready to talk about this particular topic. But prophylactic or preventative measures, one thing is limiting exposure. And we all can't live in a little bubble and stay home, even though some days I'd really like to, especially when it's cold season in the winter and everybody's coughing at the grocery stores. And I'm like, oh God, somebody just lost a lung over there. We're gonna go over there with those droplets are in there. I'm not gonna wear one of those stylish masks around because they don't look as good as people think they do. But
You go into what do you have?
yeah, I know. You know, there was a lady that always went to one of the gyms that I worked out at, and she always wore a mask. And I always wondered, and it was always around winter, so I always wondered whether she was protecting herself against everyone else. And I wondered, I think she even wore gloves too. I don't know how she develops her immune system by avoiding everything like that. But I know. But then you get to the normal, spring, summer, she wouldn't have any of that stuff on. So I don't know. I mean, I always tried to give her the benefit of the doubt and maybe thought that she had some type of immunocompromised condition, and at that time she had a higher risk of actually contracting a disease, and maybe that was why she did it. But it was funny. Yeah, I don't know why she wouldn't have invested in the gym at her house. I think that would have made her rest a little easier if she had done that. I don't know. But if she did have some immunocompromised, the gym isn't the place to go.
No.
Sweaty, stinking, yeah, it just doesn't, it doesn't go well there. Another thing that you can do is stimulate the immunity. What do I mean by that? You don't have to worry about the public health organizations there. How do you stimulate your immune system?
Probably get vaccinated or exposed to it.
Vaccines, right? So I think these particular definitions, I know you've went through probably in the nursing courses, but I will test you on this, and I will test you on the different vaccine types. So from this point on, a lot of this is what you're going to see on the exam for this particular chapter. And typically how I do it is I give you an example, and then you tell me what it is. So this first part I'll talk about natural and artificial active immunization. Then we'll get to the passive. So with natural active immunization, you just get sick and you develop your immune system, your immunity to it. So I get a cold, I develop antibodies, for instance. Artificial active immunization, you develop your immune system without necessarily getting sick. So that would be vaccination. So artificial active, these vaccinations, and these are the different types, fall under that category. I want you to know the difference in these. So attenuated vaccines, you have microorganisms or a virus that is alive, but it is attenuated, it's weakened, just like the organisms in my lab. So it's incapable, theoretically, of causing disease. Not that it doesn't multiply to a degree because it's got to provoke a response, but as far as some of those virulence factors that we've talked about, it doesn't quite completely make all of those. So it's a harmless but not so harmless guy. So it's a weakened organism. A lot of the discomfort you feel after you get a vaccination is your body making a response. Now, there are vaccines, and the one example for the attenuated I like to use is the flu mist. Now, the flu mist is the live influenza vaccine, and it's not for certain age groups. I think, I can't remember if it's below 5 or 4, and then above, is it 49 or 55? I can't remember. I've got so many different age groups that it all gets confused in there, but once you get above a certain age, you can't have the flu mist, and below a certain age. Now, they really regulated when you had asthma, because my son used to get the flu mist. Then, when he had active asthma and he was around a lot of allergens, they wouldn't let him do it. And then once that got under control, he could have the flu mist again. So they've kind of taken some of the restrictions away and kind of monitored them, but still, as far as the age groups, they don't go above and under. One of the things is, especially if you guys are going to Children's Hospital to do any type of clinicals, you can't have that particular vaccination because you shed the virus. So anybody in there that is sick can, touch, and all of a sudden they've got influenza. So this is definitely not the type of vaccine that you would want to give someone that is immunocompromised or doesn't have the ability to develop a strong immune response. Now, the inactivated vaccine, those are all killed by chemicals. The flu shot's a good example of the inactivated. So most of us get the flu shot, and if you go to any type of pediatric clinical, they'll have you do the flu shot. Now, my son and I, we always kind of watch how we do it. I prefer to do the flu mist, but sometimes it's hard to find. His pediatrician will do it. My family doctor will not, so usually I'm going around to about every Kroger's I can find to see if I can get the real one. And it does provoke a stronger immune response, the attenuated vaccines do. Typically, these guys will give you a B and a T cell response, whereas these types of vaccines only give you a B cell response. So the flu mist has actually been studied to where it can be effective or give you partial immunity for the next year, even though it's mutated a little bit. So you might have a very short brief infection. not in 100% of the cases, but it's a decent percentage. I notice when I get the flu mist vaccine over the flu shot, I always have better immune response. I remember one time my husband, he got the flu, and I think I'd had the flu mist. And I'm like, I might get it for a day, and I was about down for a day, but it wasn't real bad. And then I was just right back to normal. He was like getting all mad because he's all laid out and dead. So I'm like, well, you should get the vaccine, but I've always liked the attenuated version a little bit better. But one of the interesting things is when I get him vaccinated, I got to time myself to where I go get my vaccination first, because it can take about 2 weeks for that full immune response to happen. Then he can go get his. Because when you got the live, you need to already be kind of protected against that. So keep that in mind if you ever do that. Acellular vaccines, those contain only the antigen molecules. These types of vaccines are typically to toxins, so like tetanus, diphtheria, that whole DTaP, that's all to toxins. What happens is you make antibodies, and you're making antibodies against the toxin, not the organism itself. Now, DNA vaccines. DNA vaccines, they were real big talk about them. The one that ended up coming out was a pretty good vaccine, hepatitis B vaccine, but not everybody took to it. And still, it's one of those things that they've done studies and linked some genetic similarities to people that don't, but it's kind of out there as to everything that's going on. All right. One thing to keep in mind is vaccines do not always provide completed immunity to everyone immunized. A lot of times we've got the shot, still got sick. So sometimes it provokes a good immune response, sometimes it doesn't. Every once in a while you hear these weird things in the news that they ran out of flu vaccines and a bunch of people got a placebo or something crazy like that. Or you got a weakened, or you got half of the vaccine, you didn't get the full. And that stuff, I don't know that it really happens, but every once in a while you hear those. I remember one year they ran out of the flu vaccine.
Yeah, I was at the flu clinic and I got yelled at multiple times.
Did you?
We ran out.
It was really weird. I didn't know. I actually felt bad because I had went and gotten a shot, and the guy asked me, if I was around anyone that had this or that, and I was telling him. I had no idea they were getting ready to run out. And it was probably like a week later, and all of a sudden there was devastation, for the vaccine. And I'm like, man, I feel really, really bad. But that guy probably knew, and that's probably why. And they gave it to me because my son had asthma. And they didn't want me having that particular infection and transferring it to him. So that was why they did that. But I didn't know at the time, and I shortly found out that, it was a big old shortage. Big old
It's bad in
shortage.
the nursing homes too,
Yeah.
because we have a hard time getting it for new patients coming in.
Really?
Yeah, we had pharmacy was like back ordered way on it.
And I can't remember what I had read a bunch of stuff at that time, I can't remember what they said, but they've got so many suppliers that actually make the vaccine, so I don't know if a couple of those guys were out of the loop there, and just, they had one that they actually got it from, and they didn't make enough, I think that's what it was, but I felt really bad after I'd gotten it. It was like, somebody else probably could have used that a little more so than me, and I could have just gotten sick and dealt with it, but, it was funny because I was getting a lot of questions. I'm sitting there thinking, yeah.
Yeah, this little old lady, she was very sick. And I called her before the line, gave her the shot, and there was tall, very healthy, very vocal male that was not happy about it.
Yeah, I know.
And I'm
at
like,
that point, you're just like,
sorry, I'm out, I saved it for her,
yeah, that's just the way it is. That's
and
right.
she needed it more than you did. I'm gonna call your company. And go ahead.
And I'll call them.
Go ahead. Go ahead. Here's my name.
Soon after that, they did go to a priority list where they wouldn't vaccinate under a certain age. They did do that, but Yeah, I remember getting those questions, and then it was maybe a week that went by, I don't know. It wasn't that long, because I remember it was short enough time that I thought back to the guy asking me questions. And, you know, I think I got it at Kroger's and thought, well, what in the world are these people asking me all this stuff for, you know? And I am like allergic to eggs, so I always have one of those where they kind of want to give it to me and they kind of don't. They just want me to sit there, and I'm like, I'm not going to go into anaphylaxis. I could use the restroom all over the place, but that's about your worst case scenario, buddy. It just doesn't affect me that way. And it's so funny. They all had me sit there, and I'll just look at my watch like, do you really think that I would go into anaphylaxis to get a flu shot, you ding-dings? I'm wasting my time and your time.
In the middle of Kroger's.
It was funny. I mean, it wasn't that far after, because I remember thinking, and I remember feeling really bad, like, oh my God. I remember that. So this term herd immunity, I just want you guys to kind of understand what this means, but it's prevention by scarcity of susceptible hosts. So all that would mean is if we didn't want to get influenza, say for instance we vaccinated everybody in the room. We can skip through that one. All right, let's go to the comparison here of attenuated and activated vaccines. Attenuated vaccines, remember those are live organisms. Inactivated are killed organisms. The attenuated are genetically altered, so they have a very limited type of infection. They still multiply, but as far as the virulence factors, they're not strong like the other organisms. It does provide long-lasting immunity, and it is a stronger immune response. So as I said, in a lot of the research, they say you get a B and a T cell response. I've always had a longer lasting immunity with an attenuated vaccine, and trust me, I've really thought about it and evaluated myself for that time period. That's the kind of person that I am. Everything's a science project, even the copier, which it jammed up twice today, and I said no the third time. It's probably because the paper is coming from this drawer. I'm actually going to stop it, and I'm not going to do this again. First time it jammed, second time it jammed. I said, I'm not stupid enough to use this thing one more time. I'm going to apply a little bit of science here. I'm going to get the heck out of here and go to the other machine. Everybody's just looking at me like, yeah, it does that. I'm just like, well, I'm not using it. Yeah, it's funny. And it just sounds like it's death on the inside. But anyway. With inactivated vaccines, again, comparing these, the immunity is not long-lasting, and a lot of times it requires multiple injections. These acellular vaccines, they stimulate something called antitoxins, which is just a fancy word for an antibody to a toxin. So you have a toxoid, which is a purified exotoxin. You inactivate it with some type of heat or chemicals. And then, like for instance, with tetanus or diphtheria, pertussis, whichever one, if you were to come in contact, antibodies, part of their job is to neutralize toxins, and that's what it does. Now, as far as passive immunization, very easy here. Natural passive, you just acquire those antibodies in utero or from breast milk. Artificial passive, is everybody clear on this? The gamma globulin injections. You have pooled serum, whether it's from animals or human preps. So what's happened is, whichever type of preparation it is, that organism has already made the antibodies to that toxin, and they're just passing it to you. So if somebody has tetanus and they didn't have the vaccine, when you go into the hospital, that's what they'd be given, is gamma globulin injections. Now, the human preps are what they use a lot more so. With this animal prep, a lot of times people say they experience serum sickness, where they might have kind of like an allergic reaction to whichever specific animal it was. Sometimes they'll have hives and so forth. But this is more so with an animal preparation. Doesn't seem to provoke that sensitivity quite when you use human preps. Advantages is protection for the immunocompromised. It is immediate protection. So those antibodies that have already been developed in that human will immediately start neutralizing those toxins in your body. It is temporary protection though while your immune system develops. So you might have to have recurring injections. With rabies, those gamma globulin injections work the same way. So if you were to get bitten by an animal that you suspect has rabies, used to they give you a series of shots in the stomach. I don't think they do that really anymore, except for maybe in West Virginia they might torture you. West Virginia, I tell you what, West Virginia scares me to death. My husband, he goes down there and travels sometimes, and he'll have to go to certain jobs. But I just remember being on the elliptical one time, and I was pregnant and getting ready to go into labor probably in a month or so. And this lady telling me that she was traveling through West Virginia or something, ended up having to be in West Virginia, and they kept her legs in stirrups the whole time. That's really like just stuck in there and scared the crap out of me for a very long time. So I'm like, I just don't want to ever be traveling through West Virginia when anything happens to me. She said, yeah, they keep your legs in stirrups the whole time. And I'm like, wow. I'm like, I remember getting up, going to the bathroom, and doing whatever I needed to until it was time to push. Then your legs went in the stirrups, so that was it.
Maybe they don't believe gravity helps.
Oh, no, I don't know. Maybe she was exaggerating, but she scared the crap out of me, so I always say that. Maybe not in West Virginia, though. I don't know.
Wow.
No, I say there's a lot of normal places there. It's just, and I used to live in West Virginia when I was really young, so I don't know. It was interesting. It was interesting, but remember we used to live near this town called War. I don't know how many places are called War. Looked like war and hit it though. It was a coal mining town. It really did. Really did. But now anyway, typically they don't do those all in the stomach. They'll give you an injection, then you come back and you get another one. If you do get rabies for some reason. And that protects you for that time period until you can develop your own antibodies against it. So that's all these injections are. All right, I'll let you go after I want to review through this other one really quickly. And if you have your PowerPoint, great. If you don't, this is in chapter 1. So we've actually already talked about it, just sometimes I'll ask Cox postulates again here. So this chapter 13 and 14, we're actually going to finish on Monday.
Because it's not this Monday, it's the following Monday, right?
Right. Yeah, there isn't any way we're going to. In any way, I'm going to get everybody through 2 chapters on Tuesday. I could do that with you guys, but we just don't have that 4-hour chunk. We only have 2 hours, so once it's passed, it's passed.
You want this one? I got another
You guys, I always ask everybody to review through the universal blood body fluid precautions, but it's not going to be on the test. It's just one of those things. I know it's posted at every place that you work, at least hopefully it is, and you look at it from time to time. Just always refresh your memory with that. I don't know if this page is right. I've changed these pages I don't know how many times. I give up anymore. But I did have, if you guys remember Cox postulates, I did go through this in chapter 1. And the whole idea is to find out the etiological agent or the causative agent of disease. And this is just a cute little picture with some mice, because we use mice so much in the lab. But you have the diseased animal. And remember that suspected pathogen, you should be able to isolate that from the diseased animal. And the healthy animal, that organism should be absent. That makes sense. Now you would take that organism, grow it in pure culture. Obviously, there would not be an organism present in this guy, so nothing would grow. Postulate 3, if you injected the healthy animal, supposedly it should cause the same disease. So you could re-isolate that same organism. Now, obviously, this is one of those things that's done in a laboratory setting, not in any type of medical setting. As I said before, we can't go around injecting people, although tempting sometimes, but it doesn't go over very well. All right, so the rest of these chapters, a little bit of chapter 13, a little bit of chapter 14, a lot of chapter 15, but I kind of combined everything together. The rest of the topics really include the immune response and normal flora more so. So if you guys want to get kind of read on that, we'll start it on Monday. You guys are hot and done.
You already have.